Well, a staggering number of Cincinnati children are living in poverty.
Cincinnati is fourth worst in the nation, with more than 44% of our kids living below the poverty line. Cincinnati City Council member Yvette Simpson is with us this morning. So good to see you, Councilwoman Simpson.
Thank you so much for having me.
You wrote an op-ed last week that ran in the Inquirer. I read it last week and I read it again this morning.
Yeah.
You basically said at the beginning that the mayor doesn't really have a plan to address this. What did you mean by that?
Well, the reality is that we've got 30,000 kids who are currently in poverty. The idea that we could lift 10,000 out of poverty just isn't realistic. For one, the mobility rate, which suggests how many kids can make it out of poverty in a generation, just completely negates that number. Besides that, we know that the challenges that face our children in poverty are multifaceted. So in the study that we're doing right now, we see that kids in poverty are impacted by 4 factors at one time that are keeping them in poverty. The ability to stabilize that many factors can't happen in 4 to 5 years. So we got some real ideas about things we can do to correct the problem, but I'm not convinced that we'll be able to lift that many children out of poverty in such a short period of time.
Well, what are those 4 factors? And of the 4, which one do you go after first, or do you have to go after all 4 at the same time?
And that's what we're looking at now. So we finished phase 1 of the study. We're getting ready to finish phase 2 at the end of this month. What we show is when you take 70% of our kids, you measure them against kids out of poverty, 4 of the 6 factors that we measure are impacting our kids, and crime is one of them, health is another, education, workforce is another one. And so you see that these kids are disproportionately affected by all of these at one time, which keeps them in poverty. So what our solutions will look like is, 1, having a place-based solution. So 51% of our kids live in 9 neighborhoods.
Okay.
When you look at intervention,
so you go into those neighborhoods.
You need to be where the kids are, because transportation is a major factor for kids in poverty. 2, you have to make sure you're dealing with more than one at a time, because guess what, if you stabilize education but the kid has poor health, they're not going to make it to school. If you stabilize health and the kids are impacted by crime, parents in jail, they're shot, they're being influenced by gang activity, they're not going to make it to school. So what we're looking at now in some of our cross-tabulation is, where do we see most commonality between any 2 factors, and if we can stabilize 2, can we move some of our kids out of poverty by doing 2 or 3 at a time? And that's going to require all of our organizations to work together to create a pipeline, which is what I'm suggesting that we do.
You said in the op-ed that you grew up in poverty.
I did.
What was it that helped you get out?
So we, in my family, we were impacted by many different factors, which is one of the reasons why I wanted to do this study 2 years ago that we started. For me, the developmental opportunity was the thing that made the difference in my life. So that's things like activities, having a mentor. When you can't stabilize health, and you can't stabilize education, and you can't stabilize all these other things, that's the one factor that we see can move kids out of poverty more than anything, in part because of the resiliency of our kids. So our study measures not just the perception, but the reality of what kids are facing. And when we look at the reality, we see that the results are stark. But when we look at kids' perception, we find that it's the same. So if you look at a kid in poverty versus a kid who's at the highest level, both of them believe to the same degree that they will be successful, despite the fact that our kids in poverty are dealing with 4 times as many challenges. So we know that if we have an influence on a child's life that can help them make it through, even if we can't change the base situation that they're in, they have more of a likelihood of success.
We keep hearing about this $19 million surplus, and what are we going to do, and where is it going to go? Has there been any kind of discussion on ways we could work towards some of these solutions with that surplus, or is that not something we're talking about?
There's just one piece of it that when the administration came to me and said, if we could do something for kids, what would you do? We're taking a small portion of the money and we're using it for employing dislocated youth. In the city of Cincinnati, between the ages of 16 and 19, 11% of our kids are either not in school or not in school and not working. That's 2,000 kids who are not in school and not working. So we hope this pot of money, when leveraged against other dollars, will get those kids working. Because what our research shows is that kids who are employed are more likely to be successful and get over their challenges than kids who are unemployed.
So to get to those kids who have the same positive outlook as any other kid, Yvette, would you say to people, get involved with a kid's life, or would you say to that kid's parents, find them a program where they're finding mentors and finding people to help them out?
Absolutely. Our research is showing that for kids in poverty and kids out of poverty, very few of them have mentors, which is kind of an interesting thing that we saw common across across the spectrum. Now, of course, kids who are out of poverty probably have informal mentors in their parents and other things. So
Right.
I would say that would be an impactful way for individuals to make a difference in the lives of our kids. Now, of course, feeding kids, making sure kids have access to health care, and of course, quality education, which was great for me. I was in Head Start, and that got me off to a great educational start. But when you're going through that pipeline, you can't get to school if you're sick.
Right.
You can't get to school if you were up all night because your parents were fighting or because there were gunshots outside of your window, which a lot of our kids are facing.
Well, that's what I was going to say. What do you do for kids who mom and dad aren't around? Mom and dad
Right.
aren't being the mom and dad that they should be. How do you find those kids to make sure they are getting a mentor? And it's one thing if mom and dad are kind of looking out for you and say, you need to be in this program. What if mom and dad aren't there?
Well, I mean, I was raised by my grandmother, neither of my parents, and 56% of the kids in the city of Cincinnati are being raised by a single mom. And 18% of those women are unemployed. So stabilizing mom is a very important thing, and having other influences, whether they be teachers or mentors, can create that type of role model that kids need and the type of hope that they need to keep what they believe will be their success, to keep them on the straight and narrow so that they don't get tempted to go the other way.
We look forward to hearing more from your study and,
Right.
and the ways you put it on the ground and get it working. Yvette,
Thank you very
so
much. We're really excited. Thanks for covering this.
And thanks for taking the time. We know it's a long road ahead for everybody. All right.